Before 2005, the only major thing I'd been to the hospital for was an earache. I kept getting sick. In February 2005, I went to the hospital about 3 times in 1 month, and they kept telling me that I had an upper respiratory infection. After the 3rd time of sending me home, they realized that my heart looked enlarged on the x-ray. They called my mom and told her to bring me back as soon as possible. That night, I went back and they kept me in the hospital. My blood pressure was high and my heart rate went all the way up to about 145 that night. The next day, which was about a week after I turned 18, I found out that the pneumonia virus attacked my heart. I was diagnosed with cardiomyopathy and congestive heart failure, and later on hypothyroidism and mitral valve regurgitation. And that is where the blood is going back the wrong way in your heart, and it just makes you incredibly weak. Within 1 year, I had a transplant evaluation at Mayo Clinic. I had just gotten put on the list, and I told them that I wasn't ready. Ultimately, I was just too scared to do it, and they frightened me so much that I thought there just had to be another way to heal my heart. In 2007, I was told I was at risk for sudden cardiac death. My doctor suggested I have a defibrillator implanted into my chest. After that, I remembered that my cousin had sent me an email about stem cell treatment going on in Europe and other countries. I looked all over the internet to find out about adult stem cell therapy. So I found out they were doing it in Thailand, and Dr. Grakos in Naples, Florida was doing adult stem cell therapy in the Dominican Republic for $5,000. I started raising money little by little. I was on my local news selling heart-shaped lollipops at the flea market. I had a concert benefit thrown together and also a spaghetti dinner. I had lots of amazing people help me along the way. Also, 2 couples in South Florida donated a total of $30,000 towards my treatment. I had my treatment done in the summer of 2008, and everything was great. I felt so good, but things slowly started going downhill. I always told people I felt better, and I really just felt like everything was getting worse. I just didn't want everyone to be worried about me. All the medicines made me feel horrible and made my blood pressure so low that at times I was scared I was going to pass out while walking. I was supposed to have mitral valve surgery in South Florida, but my insurance said that it was out of the network and wouldn't be covered. So I found someone in Jacksonville to do the surgery, and the doctor never even spoke with me on the phone. His assistant called me and said, Dr. So-and-so said, said, "You are not a good candidate for this surgery and you will die on the operating table." I was crushed, and I decided I wasn't going to call anyone else because they would just tell me the same thing. I was supposed to get my teeth fixed also, but again, my insurance did not want to pay for it. My insurance kept changing their plan a lot. I started getting more and more sick. I was in the hospital once in October 2009, and then in December, I started going back into heart failure, and it was way worse than the first time. I almost died, and my life literally flashed before my eyes, and I woke up with at least 12 doctors and nurses around me. After a few weeks of trying to get off the fluid, I was told I was going to have to get a heart transplant for sure this time. Right here at Orange Park Medical, they said there was nothing else they could do for me, and they just didn't have the means to care for me anymore. They put me on dialysis to try to filter my blood to get some of the fluid off. They told me that Mayo wouldn't take my Medicaid, so I had to choose between going to Tampa or Miami. So I chose Tampa, and I was supposed to be flown by helicopter, but the weather was really bad for like 3 days. So I talked to Mr. John Brown, and he prayed for me. I was so glad that he did, because the very next day, the nurse woke me up and said, "You are going to Tampa today by ambulance." I was so excited and thrilled about getting there. Me and my mom went by ambulance. It took 3 hours to get there. It was the longest 3 hours of my life, and the most uncomfortable, because the beds are really, really uncomfortable. I got put in the hospital in Tampa General, December 18th, 2009. And the doctors were really great. My mom pretty much lived with me in the hospital the whole time. And they did tests and stuff for the evaluation. I was in the hospital from December 18th till April 10th. In January, come to find out later, my molars were infected to the bone. And they had to have an oral surgeon come into the hospital. I was just going to get a partial denture to replace all of my back teeth, but he said that I would have more problems later. And if you get gum disease, it can lead to heart disease. And I wanted to protect my new heart. So I had all of my teeth removed. I had to wait a little while too because they found out I was allergic to heparin, which is a blood thinner they use before transplant and during transplant. It made my blood platelets low, so I had to wait a few months for them to go back up. I was inactive on the waiting list for a while, but when I got put back on status 1A, it's the top of the status, top of the list, highest status, they found a match a couple weeks later. On March 1st, they came in at 5:30 in the morning and told me that they found a match for me. They took all day to actually get me in the operating room. My parents were already there, my sister came down with the kids from Jacksonville, and my amazing boyfriend Chad got a last-minute flight for $450 to come from Texas. My surgery only took 3.5 hours. While everyone was in the waiting room, the nurse came out and told them that I was okay. They were finishing up, and my heart came from a 30-year-old male. I only remember bits and pieces of the first few days after, including my birthday, March 4th. But I do remember waking up that very morning. They had already took my throat tube out, and there was a guy outside my door playing a keyboard, and I heard the music, opened my eyes and saw him, and I started flailing my hands around, and I tried to tell everyone that I wanted to play too. My boyfriend says when I woke up that he thought I was going to jump out of the bed. I guess I was trying to hug him. He also says I kept saying I wanted ice cream and that I had to fill out my lunch menu for the next day. I recovered pretty well. They had me in the cardiac ICU a little longer than most people because my kidneys weren't working so good. They had me on dialysis for a week. I also had to go back into surgery because they had to do a pericardial window and cut the bottom of my incision back open. I had fluid around the new heart, and it was making me retain fluid in the rest of my body. They took out about a ½ liter and put a tiny drain in my abdomen. My thighs were like tree trunks, and it was very hard to move around. My liver is great now. I have no more high bilirubin, no more yellow skin, jaundice. I feel like I did 6 years ago. I got out of the hospital on April 10th, and I got my dentures on May 13th. We had to stay locally in Tampa for about 2 months. I came home to Jacksonville in the beginning of June in time to see my oldest niece graduate. Just a couple months ago, I went to Texas to stay with my boyfriend for almost 2 months and had a wonderful time. I'm doing great, feeling great. I've only had rejection once, just a tiny bit. I started out on 18 medicines, and now I'm down to 5 prescribed medicines and 3 vitamins. I've written a letter to my donor family a couple months ago, and I really hope they write me back. I hope to go to school to be a nurse assistant in the summer, and I want to get back to the others because I know how much it matters and what a difference one person can make.
I got to correct her on something. You were talking about Dr. Graycoast and the stem cell. You said 5,000. It was actually 50,000. You said 5,000.
I meant 50.
1,000.
A lot.
Just to let everybody know.
Does anybody have any questions for Sarah?
Oh, one more thing. My whole hospital bill for being in hospital was over $2 million. Transplant is $100,000.
Any questions anybody has about her experience?
The insurance pay for it?
Medicaid, yes.
Wow.
All of it. Except for like $100, I think.
And going through what you've been through, what was the most difficult for you?
I think before the transplant, the waiting and not knowing if I was going to be able to pay for my medicines or if insurance was going to cover it and what was going to happen.
So just worrying about what the outcome was going to be and if it was going to happen. Well, certainly, I think we can understand that. And you're feeling good now?
Yeah, I'm doing good. I've had rejection only once, and they just found a few white blood cells in my tissue because they take tissue out of the biopsy.
And what's the biggest struggle for you now, or is there? And what are your plans?
I don't really have any struggles right now. I hope to go to school.
Okay. And what do you want to go to school for?
Nurse assistant.
Oh, okay.
Or nurse, either one.
You're going to come back here and work for Jennifer?
Sarah, I think we're all just moved
Yeah.
by your story, obviously. What excites us on our side, from Orange Park side, this is the director of ICU. You may not have known her intimately while you were here, but she oversees the operations of the ICU. And unfortunately, it came to a point where Orange Park didn't do the services that you needed.
Yeah.
But we're doing Open Heart now, and a lot of growth has happened even since you left us.
Yeah.
But the story then continues for me because I'm director for, think of it as patient relations and spiritual care. And to learn that, and of course Michael's the senior chaplain, but to learn that one of our spiritual care people connected with you and kept connecting with you even when you left here. Yeah. We wouldn't have heard this story. We wouldn't have seen the beautiful outcome. And this is just, we have a group of folks that pray all the time for our patients. I certainly do, Michael does, and thank you, John, for following Sarah, because you've blessed all of us by following her. I know Benjamin countless times follows patients home to wherever they are. That's a blessing to us at the hospital. We don't want to lose contact with you, Sarah.
And we've got a couple things, and John, I want you to come up here as well. This is just a certificate that says the Spiritual Care Department of Orange Park Medical Center proudly presents the Spiritual Care Department honorary member certificate of recognition to Sarah Marie Copeland for her courage and contribution to the Spiritual Care Department in helping us understand patient needs in ministry. And so,
thank you.
This is from the whole Spiritual Care Department. So we want you to open that if you would. You put it down right here and open it up.
Heavy.
It is.
You gonna hurt it if I turn it over?
No. Plain brown box.
Brown box.
Those more boxes inside. No.
Bible.
Yeah, it's a study Bible,
Oh, it's heavy.
and it has everybody in the Spiritual Care Department has signed it. So it says, presented to Sarah Marie Copeland from the Spiritual Care Department on January 13, 2011.
and we're going to have some ice cream and cake.
You need to go look at the cool cake we got.
We'll look at the cake. But if it's okay with your parents and with you and everybody else, we'd like to have a prayer. So if we could stand up and kind of just hold hands.